The reported death toll Wednesday would make it the deadliest alleged chemical attack in Syria's civil war. Syrian anti-government activists accuse the regime of carrying out a toxic gas attack that has killed hundreds of people.
It's a horrible situation. I mean, it's scary. This is, of course, not the first time that we have a chemical weapon attack in Syria, but this is the largest scale. We're talking about very large metropolitan area with high concentration of civilians. Many of the deaths are civilians, unfortunately. About 50%, according to the doctors I spoke with, are children and women.
Already we're very concerned. Already the whole country is under shelling, and it's big crisis. When you firsthand see people in the camps and in the refugees camps, when you see these kids, like they're suffering from all kinds of diseases, and there's minimum help.
We had a person with shrapnel injury.
Dr. Abdelmajid Katranji of East Lansing is one of those few.
I've had the honor to help and serve and assist people that are Alawite, that are Christian, that are Sunni, that are Shiite, with the government, that are against the government, anybody who needs help. We do not care.
90% of the medical infrastructure in Syria is completely destroyed. There's 10 million Syrians who are, in a way, refugees either inside Syria or outside Syria. These people left without their medicine, their insulin, their diabetes medicine, heart medicine. They can't live without them for a few days. So we start getting medication for chronic conditions. These are people to try to keep these people alive. In the beginning, people started going to the regular hospitals. And instead of being treated, they were being killed. So people stopped going to the hospital. Even private hospitals were not allowed to treat any injury. So the need was, you need small basement hospitals, hidden small room to change into a little emergency room, but these rooms have nothing, you know. So they were treating people with napkins and basic equipment. And so we had to, they were calling us, the doctors, we were in contact with the doctors inside all the time. What do you need? And then we start collecting the donation from here and try to find a ways of sending inside Syria in a different way.
We taught them how to brush.
Omar, who's an orthodontist, went to Syria this summer to help refugees with dental care. 1/4 of the 4 million refugees are children.
I saw devastations everywhere, but I saw people that are resilient.
Looking what happened in the last couple of years and the atrocity and the number that is coming out from the United Nations. Yesterday they say 7 million out of the population has been displaced. That's 1/3 of the country. And the longer this war or conflict continues, the more likely we're going to see more bloodshed. So to me, any intervention that might decrease the atrocity of the regime against its own people would be welcome.
Dr. Harb, you grew up in Syria, I understand, and you still have family there. What are they telling you about what the living conditions are right now?
Lack of food. There's no place safe to be at this point, and there's no access to good health care, or basic health care, in fact.
Okay. And you're a member of the San Diego Syrian American Medical Society and the Save Syrian Lives campaign. Tell us what that campaign is doing.
This campaign is a non-for-profit, non-political that aims to fund and rush medical supplies to the areas inside Syria and in the refugees camp for the millions of people that are suffering and lacking the essential of medical and health care.
So the 2 million refugees, but also you're setting up, I understand, clinics, mobile health clinics?
So SAMS, through the Save Syrian Lives campaign, has built about 25 field hospitals, trained physicians to deal and treat innocent victims of this ongoing conflict, as well as we have to remember to train first responders for triage of patients of chemical assaults.
Even little kids playing in the streets would get shot indiscriminately by snipers. So a lot of the injuries we treated were just little kids getting shot in the head, shot in the leg. It was a very peaceful city, and when they drove me around, there were just, the amount of destruction was just devastating.